Anterion is a swept source OCT that has been optimized for the anterior chamber, anterior segment of the eye. The unique features are that the technology allows us to produce images of the highest quality. We have a swept source that runs at 1300 nanometers that allows for deep tissue penetration. We have a fast scan at 50,000 hertz, allowing multiple images to be taken in a very, very short time frame. In addition, we have an eye tracking system that eliminates any eye movement and allows us to produce images of the highest quality. Firstly, the image is of the quality that it allows us to see all the anatomical characteristics of the anterior portion of the eye. This allows us to make measurements and estimate distances within the eye and assist surgeons make surgical decisions. We also have the ability to ray trace the cornea, ray trace the lens, and that allows us in turn to produce maps of corneal power, corneal thickness, topography and tomography that allow cornea and refractive surgeons to make very good decisions about the surgical procedures that they may undertake. This high quality imaging allows us to produce highly reproducible data. The reproducible data can then go into surgical planning systems that allow cataract surgery with high level of IOL power prediction and the monitoring of cornea disease. The technology has allowed us to develop three new features. Firstly, the high quality image has allowed our researchers to develop an algorithm that automatically detects the scleral spur. And this will go a long way to helping glaucoma surgeons monitor those patients with angle closure disease. Secondly, the high quality segmentation of the cornea has permitted us to now provide data on corneal epithelium and residual stroma thickness. And this is of great interest to refractive surgeons, those that are monitoring dry eye, and also those clinicians that are seeking to monitor the development of corneal ectasia in higher degree. And finally, we have an ectasia display. The ectasia display is a means to present meaningful clinical data about corneal change to the cornea surgeon. It will allow us to detect the risk. It will also allow us to monitor disease and to monitor the effectiveness of treatment by looking at parameters that are sensitive to detection of keratoconus and other ectatic diseases. So in summary, Anterion is a multimodal device. It's a device that suits many eye clinic situations. It has features that are attractive to the cornea and refractive surgeon, and hence why at ESCRS we present it to you, and also to the glaucoma physicians who are very interested to look at all forms of glaucoma and especially angle closure disease. Anterion provides ophthalmologists with a number of unmet needs. Firstly, the high quality images provides diagnostic confidence, allowing monitoring of disease and treatments to a very high level. Secondly, the measurements that are provided by Anterion are used to give predictive and accurate outcomes from surgical procedures. And finally, as a multimodal device, Anterion saves space and saves time by combining multiple disciplines in one simple to use instrument.